AM 1430 KRGI 105.5 FM. Good morning. I'm Brian Gallagher. Guest on hand from Central District Health Department. The guy, Mike Bachoven, has come by to bring us back up to date. Good morning.
Hey, good morning. How are you?
Good. So what's on the agenda today?
All right. So one of the things that has been happening lately at the health department that people have noticed, because it's right there on South Locust, our building is right there on South Locust, one of the main thoroughfares, is we've changed our sign. So you come look at our sign, and it's been the same for how long have we been in that building? 15 years, something like that. And we have we've changed it, and we look a little different. And so we've had some people wondering, well, why do you look different? And that's what I wanted to talk to you about a little bit today. So we did a rebrand, which is a little bit of a technical thing, but the basic gist is we just freshened up our look a little bit. And the reason we did that is because we're mostly clear of the pandemic, although that's still something you need to worry about. We're in a space where we are providing just a massive amount of services for our public, and we wanted to reflect kind of who we are a little bit better than maybe we had been, 15, 20, 25 years ago.
So there's some color changes, and the logo itself has changed, and I even noticed here a couple of weeks ago from an email.
Yeah.
But it's something that everybody goes through. I mean, I rebranded myself. I have more of a gray tint now, and I just to show my years on the radio, and without having the picture to show you right now, I'm sure when we meet sometime you'll go, so I get it. Yeah,
young buck to elder statesman. Right? Yeah. So that sort of idea. But part of what we did it for a number of different reasons. But what we want people to know first and foremost is we still are the health department. We are still part of a network of 17 health departments across Nebraska, which is a big number. I mean, there are a lot of health departments, and right now there are a lot of pretty big things happening inside our building with the new sign out front. So, I mean, from our, WIC office that is doing record numbers, and helping kids throughout the community to, refugee and immigrant services to, community education, tracking diseases, all those things that we do, it's happening at a pretty high level right now. And it was kind of fortuitous that the change happened while we're kind of firing on all cylinders.
If we think back, and thinking back is so easy, but it started 4 years ago with the pandemic.
Yeah.
I mean, even they called it COVID-19 because you were starting to see things come out right around the holidays. But really, January, February, and March of 2020 was when the world blew up.
Yeah.
And, folks around here saw it, felt it. Some had, unfortunately, the serious effects of COVID. Most of us have made it through and found ways to look back and tell stories. But you guys were right in the heart of that entire thing and, have just been champions of making sure that people get as much understanding as possible, get the knowledge, have access to the vaccines, and even the thinking of the future. Because, as we've discovered 4 years later, we're not done.
Yeah, it's a different situation, and of course we have tools to fight it. But you talk about purification by fire. You talk about getting better because you have to. That sort of thing. I would point toward public health as one of those things where we are better now than we were, and because we had to be. And I know a lot of people who feel that way. But it's one of those things too where a lot of public health departments have collaborated, worked together, done different things, and we're really kind of seeing the fruits of that now. There's a group called the Nebraska Association of Local Health Directors that we're part of that just does some fantastic work, and we're changing our websites to kind of be more of a piece, and it's just a different world, but in some ways one that we're proud to be on the other side of.
Mike Bachoven's here from Central District Health Department. Next time you get by the building, take a look and notice the new logo, the new look. Stop in if you have questions to find out about new information that might be available. And, of course, the website's always available at cdhd.ne.gov.
You got it.
Well, we've had a little practice at this.
Yes, I think so.
But, they do such great service and, really wonderful at keeping us up to date. So I know you've got some folks that are coming in to lend a hand and carry on the message for the future. So look forward to getting a chance to work with them and talk with them and have them learn the ways of life here in Central
Ways
Nebraska.
of life in Central Nebraska, yeah. And Hall, Hamilton, and Merritt County is who we serve, but, we're part of a larger network, and that's always something we like talking about.
Mike Bachhoven from Central District Health, always a pleasure.
Hey, thank you, sir.
Good morning from AM 1430 KRGI 105.5 FM.